Get ready to pick your jaw up off the floor. On today's episode of Make It Make Sense Cardiology Edition, I am going to connect the dots with, this is a good one. For those of you who are interested in the peer-reviewed journals from which the data was obtained to substantiate this post, feel free to head on over to the comments section. And the first comment that you will see from me lists all the citations for the studies that I read and got the information from to make this post. Because if you're anything like me, you're going to want to do your own homework and read the research for yourself. I totally get it, totally respect it. That said, it is estimated based off of a 2021 study that over 200 million people globally use some sort of marijuana product, predominantly in the inhalation or smoking form. Sometimes it comes from direct smoking, sometimes it comes from vaping. Either way, the most common form of ingestion is by way of inhalation smoking. And this is not to say that it's just adult use either, because there is a disproportionate amount of use in the younger demographic, and we're talking 15, 16 or so years old. Nonetheless, the research that has been obtained clearly demonstrates that there is a correlation between marijuana use and impacts on the heart. Predominantly in arrhythmia form, but also can come by way of atherosclerotic disease and even cardiomyopathy. Let's walk through the pathway. The body has what is called an endocannabinoid system, and this system is comprised of enzymes and communication signaling molecules and receptor sites that, when activated, they trigger a certain response. In this endocannabinoid system, we are going to focus on the cannabinoid receptors for the purposes of this post. There are two cannabinoid receptors. There is CB1, cannabinoid 1, and then there's cannabinoid 2. Cannabinoid 1 is predominantly found in brain and nervous system tissue, predominantly, not the only place that it is found. Bookmark that, okay? And then CB2 is predominantly found in your immune system. The relevance of these activation, receptor sites lies in the active chemical compound in marijuana, THC, which is an acronym for tetrahydrocannabinol, long name, so we're just going to stick with THC. When THC enters into the bloodstream, it ends up activating the CB1 and CB2. It attaches itself to the CB1 and CB2 receptors. When those receptors are turned on, then certain or certain physiological functions will take place in the body. Now, remember I said that CB1 is predominantly found in brain and nervous tissue. And what that does once activated is that it inhibits the pain response from the brain, which is why medicinal marijuana is commonly used for chronic pain management in a certain patient demographic. It works, make no mistake, it works. However, I also did say that CB1 receptors are found elsewhere, predominantly in brain and nervous system tissue, absolutely, but they're found elsewhere. Guess where else? Shocker. They're found in the heart also, amongst other places, but I do cardiology, so that's my area of interest. The CB1 receptors that are found within the cardiac cellular makeup serve a tremendous purpose. When these CB cells are activated, again, by the THC, certain things happen. And the activation and subsequent response from the CB1 cells honestly depends on the dose of marijuana that has entered the bloodstream. Because in small doses, and for the sake of full transparency, small doses for one doesn't necessarily mean small doses across the board. Because even though everyone can appreciate that we are anatomically similar, male to male, female to female. We are anatomically similar, but yet and still, we are still metabolically individual and unique. This is why 2 Tylenol may take care of some person's headache, don't touch another person's pain whatsoever. We are individuals. So low dose for one is not necessarily equivalent to low dose for another, be that as it may. THC in low doses, when they activate the CB1 receptor sites of the heart, they actually cause bradycardia, or a slower than normal heart rate. This is because when that cellular, or when that activation happens, the THC activates the CB1, it actually tells the brain to block the release of norepinephrine. Norepinephrine is a neurotransmitter that stimulates heart rate to increase. So if you block that receptor, heart rate is going to stay lower than normal. And this is why you have some people who say when they partake in the marijuana, then they feel very calm, very relaxed, very chill, and it is legitimately because metabolically their brain has told the heart to slow down. On the other side of that same coin, if there is an abundance of THC in circulation, be it from one particular incident, or if this is somebody who is smoking a lot on a routine basis, chronic marijuana smoking pretty regularly. If there's an abundance of this CB1 activation, it does the absolute opposite. It tells the brain to activate the fight or flight response. And we've talked about this before. What happens when the fight or flight response is triggered or stimulated? That then releases a cascade of hormones, namely adrenaline, and that causes the heart rate to speed up, yada, yada, yada. This is why you have some people who, when they smoke, they have these paranoid feelings. They don't feel calm and relaxed. They get paranoia. They feel the heart racing. The researchers, and again, the peer journals, you can find them in the comments. The researchers who did these studies showed that when these tachycardic episodes happen, more often than not, these are atrial-mediated tachycardias, meaning you have premature atrial contractions at the low end of the spectrum. Then you have a good number of study participants who ended up with atrial fibrillation. And you also had some study participants who ended up with SVT. Interesting, isn't it? When the CB1 receptors of the heart are activated, and again, dose mediated, there has also been sufficient evidence to show that you have endothelial inflammation that occurs, and even muscle tissue fibrosis in the heart. How is all of this relevant? Connect the dots. Not a problem. When you have increased endothelial inflammation, what happens is the arteries that bring blood flow into the heart, and not just into the heart but all around the body, endothelial inflammation leads to decreased pliability of the arteries and the arterial network. Decreased pliability of the arteries means stiff arteries. What happens with stiff arteries? Increased peripheral vascular resistance. What happens with increased peripheral vascular resistance? Increased cardiac workload. What happens when the cardiac workload is increased beyond the heart's current capacity? Troponin rise, troponin leak, myocardial injury. You see the dots connecting? Ding, ding, ding. Fibrosis of cardiac muscle. When that happens, it ends up impairing the heart's conduction system, because the electrical stimulus, or not stimulus, the electrical impulse that is trying to come through the heart's conduction system won't be able to reach its desired endpoint. The heart muscle on the other side of that conduction network won't be able to receive its signal. When that muscle cannot receive its signal, the muscle doesn't move like it's supposed to normally move. When the heart muscle does not move like it's supposed to normally move, that affects the rhythm. Bada boom. Pick your jaw up off the floor. I told you it was coming. Now, mind you, these are transient happenings with the THC and subsequent marijuana use on the heart, the impact on the heart. These are transient. These are transient. There is, however, a paucity of research that shows that there could be a lasting effect because of everything that we just described, everything that we just talked about. Nonetheless, the bottom line is, for those who partake in marijuana use, I'm not one of them. I have never smoked marijuana a day in my life, and I just have no desire to want to do that. But no judgment. You do you. You're an adult. You do what you want to do with your adult money and your adult time. But just understand there are consequences to every action. Bottom line is that if you do partake in such extracurricular activities, be mindful. Be mindful that it can have an effect on your heart. And clinicians, for those of you who are investigating any sort of arrhythmia, be it a tachyarrhythmia, be it a bradyarrhythmia, it is clinically prudent for you to do a urine toxicology screen on your patient so that you can look at any and every possible contributing and contextual factor so that you can have good objective data to be able to treat your patient accordingly. That's it, and that's all for today. I told y'all I was going to hit you with a good one. Like, follow, post, reshare, all that good stuff. And again, the research studies, citations will be noted in the comments for all of you who are interested. Talk to me. Tell me what you think about this one. Looking forward to hearing your comments. Later.